specializes in long-term care. And I want to thank him for his service. He's a former U.S. I don't know if you're ever former U.S. Marines.
Once a Marine, always a Marine.
Right. And we appreciate your service and thank you very much. And as I say before every show, remember, elder abuse doesn't report itself. And if you have any comments, concerns, or issues you want us to address, please email your thoughts to safe@americaswebradio.com. So with that, Will, if you give us a little background of yourself, and we'll continue on about nursing homes and long-term care today.
Sure. As you said, I was in the Marine Corps from 96 to 2000, and I was infantry, so when I got out, there wasn't really a transferable skill there specifically. And luckily at the time, my father was a nurse at a nursing home. And he said, while you're going to college, and I had plans to go to law school, I'll set you up with this certified nursing assistant class. So it was a 2-week course. I took it and started working in nursing homes, and ended up being a CNA in nursing homes across Georgia for about 8 years. Went to school in Augusta, Georgia, and then went to Georgia State and graduated 2010. And I know you had Melanie McNeil on here,
right? Who's
the head of the Georgia Long-Term Care Ombudsman Program. I just want to give a shout out to her because she also went to Georgia State University College of Law. But when I first got out, these cases are extremely complicated, and the reality is they're extremely expensive for attorneys because you have to hire multiple experts. They're not just medical malpractice cases, they're also corporate misconduct cases. And so at first I really, I couldn't jump right into that. And I just did criminal law, getting a lot of trial experience. I met my law partner, Rob Schink, who had worked at an international corporate firm doing corporate law and litigation. And in 2014, we formed Schink Smith. And in 2016, we dedicated everything to just nursing home abuse and neglect. And that's all we do right now.
I see you have it shows a Nashville office or affiliate, or
that's right.
So you're just not working just cases in Georgia. You open the working cases wherever you can help people.
That's right. My law partner is I like to say he's the brains of the operation. He's a bit of a nerd, and he's barred in 5 different states.
No, wait, not barred. He belongs to the bar.
Right. He's not prohibited.
Yeah, right.
He is a member of the bar in 5 different states.
Right.
So he's, he's all around. But yeah, he's also from Tennessee, from a place called Mountain Juliet, Tennessee, right outside of Nashville. So we've got an office there as well.
Oh, that's great. And your commitment to helping fight institutional abuse, be it on your professional law skills, is you also participate in conferences around the country. You just said you just came back from Washington. You want to tell the listeners what that conference was about?
Sure. I once a year, the conference that I just went to was in Washington, D.C., and it was put on by the American Association of Justice, which is a national bar for for attorneys in the field of personal injury. And specifically, this conference was about nursing home abuse and neglect. There's also another conference that's put on by Consumer Voice. And Consumer Voice is basically the National Association of Ombudsmen in America. And it's an advocacy group that promotes welfare for all members of the long-term care community. So nursing home, assisted living, anybody who's a senior and living in the long-term care community.
Well, on your, I was fortunate to come to your office and participate in a podcast that you do, and just tell the listeners what your what your law firm does in terms of podcasts and
Yeah.
how they can access it.
So the podcast is nursinghomeabusepodcast.com. It also, our website, which is Schenk SCHENK Smith.com. You can see the podcast on there. But it also brings up a good point that we're talking about nursing home abuse, and technically abuse is a legal term of art, and it has to do with the willful infliction of physical harm or financial harm or emotional harm. We use it kind of as a catch-all term to include neglect. Neglect technically is the failure to provide services that meet the standard of care. But it's a general catch-all term for us. I don't really differentiate when I'm talking to most people, and that's why our podcast is nursinghomeabusepodcast.com instead of neglect, because to me, neglect, abuse, like I was talking with the station owner earlier, it just shouldn't happen. It's taking advantage and injuring the most vulnerable members of society is one of the most deplorable things that a human can do.
I can't see anybody arguing with on that. That is horrible, and some of the conditions that are seen around the country and probably around the world in these long-term care homes. We talked about a case here in Georgia that got a lot of attention, and it was a 92-year-old woman in a nursing home who was found covered with ants.
Mm-hmm.
And without going into the details, there is a lawsuit involved in it, but it's something that people should. It's an issue. You go to visit a loved one, a friend, or whatever it is. If you can just go over some of the things that you think that should be, turn the red light on and say something's wrong in your mind.
As far as red flags for families, look, as far as those cases are concerned, there's two issues. One, that ants got into the room at all. The shocking part is that it took so long for them to discover that they were eating this woman alive.
Right.
So if you are going to put a loved one in a nursing home, or you have a loved one in some sort of long-term care setting, go to the facility, check it out. Is it clean? Does it smell nice? Does it seem like the kind of place that ants could get in? And even more so, does it seem like the kind of place that it would take them days to discover that somebody was covered in ants?
That's one thing. I know we had another case that got national news here in the United States. The Washington Post did a investigative report on, was a case in Northwest Georgia where they found a woman with, I believe it was scabies.
Oh God, yeah, scabies.
And again, this was seen by her friends and her relatives. Our concern from the government, from the North Georgia Elder Abuse Task Force, which I'm the law enforcement coordinator on, is we have a very strict mandated reporter law here.
Mm-hmm.
Somebody should have told somebody about this to an independent third party, whether it be Adult Protective Services, healthcare facilities regulation, or just your local law enforcement, the sheriff or police. And when people see this and don't report it, there's no way we can help the victim, and that's the immediate thing you want.
And what it comes down to is, I like to say the root of all evil in the long-term care setting is a lack of staffing, and the fact that you don't have. And to be clear, a lot of the people who work in these places, CNAs, the nurses, are amazing people, and we don't sue individual CNAs or nurses. It's always the corporation that owns these places, because even though there are multiple bad actors that we see, as far as CNAs, which are certified nursing assistants or nurses, a lot of the times, like in this situation, there's not enough staff. People are doing everything they can to provide the care that they know they must provide to the residents, and it goes overlooked. And I don't think anybody realized that the condition of her skin was caused by scabies. And the horrible part of this one is when she finally goes to the hospital, her fingers are falling off.
Yeah, I'm not so sure if she ever made it to the hospital.
Yeah.
I think
the EMT who came.
Right,
yeah.
right, and there was conversation.
Yeah.
But again, we're not here trying to determine a criminal case or the civil case. We're just here trying to remind everybody, please tell somebody when you're concerned. Give us your the broad scope of what long-term care means.
So long-term care can involve several different places. You can have a personal care home, you can have assisted living, you can have adult daycare centers, or you can have skilled nursing facilities. I have discovered that most people I talk to, when they think of nursing homes, they're really thinking of assisted living facilities.
Right.
Assisted living facilities are places, they're still regulated by the state, but typically the residents can take care of themselves for the most part. They need just basic assistance with activities of daily living. There's a huge difference between that and a nursing home. A nursing home requires a medical referral, and it is it's a place, they're technically called skilled nursing facilities, and most of the residents require around the clock medical attention, and many of the residents require absolute assistance, and that's something that's determined by their assessment in the beginning, and that also relates to how they're compensated by Medicare and Medicaid.
Right, and I think most of these entities you discuss, certainly here in the United States, and I would think all over the world, would have some kind of a regulations or a licensing format where to keep a basic level of care and a level of safety and at these locations. Is that your experience? So
the story of long-term care regulation really starts with Reagan in the 80s. Prior to the Nursing Home Reform Act of 1987 under Reagan, it was the Wild West. It was, like I was telling David earlier, it was one flew over the cuckoo's nest. There was no regulation. There were no requirements. They were getting money from the federal government, but nobody had any oversight. So 1987 saw the Nursing Home Reform Act, which started putting certain requirements on how much staffing you have, requirements for reporting, and then a resident bill of rights, which is was not there, and you would almost I guess suspect that it was understood that residents had rights, but until it was written down and mandated, they really didn't have any rights. They were just individuals that were tossed aside, and you have horrible situations that happen nowadays, but back then it was it was terrible.
Right, and I think there were many books and articles written about that.
Yeah.
Well, with that, we'll end our first segment today on the Safe Senior Hour, and we will be back shortly.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
Hello, I'm Dr. Mike Karuchak. Have you ever wondered what doctors talk about amongst themselves? If you do, join us on the Doctor's Lounge and hear the doctors' conversations amongst themselves. Join me and my co-host, Dr. Hal, every Thursday morning, 8 to 9 a.m.
Well, with that, we'll end our first segment today on the Safe Senior Hour, and we will be back shortly.
All right.
Well, with that, we'll end our first segment today on the Safe Senior Hour, and we will be back shortly.
every Thursday morning, 8 to 9 a.m.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Well, welcome back to the second segment of the Safe Senior Hour. Joe Gavalis here, and our guest is Will Smith, a trial attorney who focuses on representing clients injured due to negligence of others, especially concerning in long-term care areas. And he's in today and sharing his knowledge. As I told in the first segment, he was a Marine, or still is a Marine, I guess, however you have to say that, but was a certified nurse's assistant.
Yeah.
So you've seen it from the inside, the outside, and you've seen things that have gone to court and have been successful.
Yes.
And I know some of them have been unsuccessful, but at least there's been some effort to try to address the situations. So with that, just if you can go over some of the things that you think are red flags for people going in to see their loved ones, whether it's a nursing home or whether it's an assisted living or personal care home.
Sure. Like we were talking earlier, the root problem in all long-term care abuse and neglect is ultimately a lack of staffing. So the best thing that you can do, I mean, there are several websites that you can go to and look at the star rating, which is also the subject of a lot of controversy, how they come up with that rating. So don't put all your faith in it. But nursinghomecompare.gov is the Centers for Medicare and Medicaid Services website. It'll certainly give you an idea of what you're looking at and what nursing homes are in your area. It also has a list of reports that have been done on discrepancies in the nursing home. But the most important thing that you can do, and I can't stress this enough, you have to go out physically to the facility. You have to go do that reconnaissance. Go out there, go inside the facility, go talk to people. Do the people look happy that are in there? I mean, you're inevitably there will be somebody that may not be happy or may be crying or screaming, and they're trying to take care of that situation. But ultimately, are the staff friendly? What does the place smell like? That's extremely important. Eat a meal while you're out there. I can't tell you how important the food aspect of it is. I just met with a family yesterday whose mother passed away, unfortunately, because of an infection that was overlooked. And her major complaint was the food's terrible. You know what I mean? And that's an important part of quality of life. So go out there, physically meet everybody, eat the food, talk to the people, meet the administration, and see how they react to you.
Right. This survey or review of the homes, is this a national listing that anybody can look at?
Sure, absolutely. Not only is it anybody can look at it, but it should be hanging up in the nursing home, the most recent survey. So the Centers for Medicare and Medicaid Services, if you're a skilled nursing facility that receives Medicare or Medicaid, which they almost all do, 60% of institutions in America receive money from CMS. I think in 2018, we spent like $1 trillion, the federal government, on healthcare, and 500 million of that, half a billion was, 500 billion of that was healthcare, right? And then about 70 billion to 200 billion, whether you're looking at Medicare or Medicaid, is spent on long-term care setting. So because of all that money, the obligation they have is that they're open to state inspectors. And CMS will send individuals out there either on an as-needed basis if somebody makes a complaint. So if you make a complaint to the Department of Community Health of Georgia, they will send individuals out there to investigate the facility. Also, there are yearly investigations where they come and just make sure that everybody's at compliance. In the same way that if you go to a restaurant, you
Right.
should be able to see the health score. So if you go there, to take your family to eat and they've got an F, don't eat there, right? So they can't hide this from you. You go there, and if you can't find it, go ask the director of nursing or the administrator, hey, where's the most recent discrepancy report?
But you can go on, let's say we're out in Boise, Idaho, for
Sure.
example. You can go on this website and
Yep.
look for the long-term care facilities or nursing homes
That's
on there in the Boise area.
Yeah.
Now, I know in Georgia, I think there were, I don't want to give round numbers, I think there were like 385 nursing facilities, and 370 something of them are dealing with the federal government. The other 10 or 15 are private. Is that pretty, just substantiates what you're saying,
Yeah.
private versus
Yeah, there are
Government.
There are about 15,000 in the United States. 65% are getting money from CMS, and there's about 21,000 to 30,000 nursing home residents in Georgia that are having a lot of their care paid for by the federal government.
and CMS again is
The Centers for Medicare and Medicaid Services, and they're a department of Health and Human Services, the federal government.
now when you look at these reports, which obviously you do in your investigation of a complaint,
Yeah.
whatever, how detailed are they? The inspections.
It depends on the inspector. They're like anything else. There are times when they overlook things. There are times when they go soft on a facility, but they are typically pretty good. If there is a resident that's put in immediate danger. The Office of the Inspector General of the United States found that 35% of Medicare recipients face some sort of adverse event which resulted in injury or death. So they're very aware of what's going on, and they try to do a good
Yeah, when
job.
you said that, the Inspector General of Health and Human
Of
Services.
the United States, the federal,
Of the health, yeah, right.
Yeah.
Because there are various Inspector Generals.
right.
This is the one that just focuses in on that.
Yeah.
And I know going through certainly in our state, at Georgia here, that you can go through and check records on personal care homes or assisted living homes, that
Yes.
they will show you their public. Is that
Yes.
pretty much your experience around the country?
Around the country, it varies. It varies from state to state. The regulations are stricter in some states.
Right.
And Georgia doesn't have the strictest regulations. As a matter of fact, and I love this state, but we have one of the poorest records of long-term care. I'm not really sure why that is. But yeah, that is pretty much my experience. Any place that you go, ask them what their records are. Although personal care homes can be pretty tricky because they're less regulated than skilled nursing facilities.
Right, but they do have to be licensed.
Yeah, they do have to be
and
licensed.
The unlicensed homes, you can have some horrible conditions, and we have made from and just in North Georgia around, I know in the Augusta area, they have they have a task force that just looks at these unlicensed homes.
Yeah.
And we have found here in Georgia that the owners of a lot of these unlicensed homes, or a lot of times there'll be a combination. They'll have one licensed and 5 unlicensed, but they'll be going around trying to pick up people and actually traffic in this human trafficking to get their Medicaid, their Social Security, their veterans benefits, or their EBT food stamp cards.
Yeah.
And then they give them horrible care. Just some of the areas to look at when you go into a nursing home or a long-term facility, some things to look at. And it depends if we're talking about a personal care home or a long-term or a nursing home, but some things that I have seen that have been addressed, that just be concerned of residents in the same closing every time you see them.
That's a very good one, Joe.
We had a matter here and the case ended up with, just tell you the ending. They ended up going to jail for many years, like 5 or 10 years.
Yeah.
They conveniently, when the loved one says, I want to come out and see Uncle John or see Bob, it just happens to be the day it was their turn to go out and go to Wendy's or go to a buffet lunch, and you can meet us there, and this is great. We'll have two birds, one stone.
Yeah.
No, you have to go unplanned and go look at it, because the show conditions look great when they show you the homes or they show it to you, but the actual conditions are not good. They're horrible. And one case, one of the cases I'm thinking of, they lived there 2 in a room with a curtain between them. The plumbing didn't work. They were using buckets, and there were maggots, and it was just the refrigerator.
Oh my God.
And the only food they were given were bologna sandwiches. Yet they were collecting here in Georgia. It's like $600 per person.
No, I mean there's a lot of Potemkin villages set up for you to be fooled into thinking your loved one's getting care. And to expound on what you're saying, if you go there and there are several residents in hospital gowns, that's a red flag. Sometimes you'll have because it's really easy to put a hospital gown on somebody, right? And to me, that's a sure sign that there's not enough staffing. Although, if you see one person, I would inquire about it. Sometimes residents will insist on it because that's what they want. But it's certainly a red flag for me.
Well, I know there are many red flags when you look at these unlicensed personal care homes, and you should be concerned about your loved one that's in there. And again, it's not just for the elderly; it's for the disabled too. And so here we call it at-risk adults. But some of the other issues that you should look at, if it looks like that you see that there's wires running from one house to another, that'll be an indication that they're operating maybe under the the cover of a licensed home, but they really are not. Okay. So with that, we're going to end this segment, and then we'll be back shortly.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
Obamacare is failing, but in order to get back on the right track with health policy, people need to be informed. ObamacareWatch.org is your resource to understand what's happening with this law and what you can do to stay active, stay informed, and make positive change happen. ObamacareWatch.org. Visit us now.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Well, welcome back to the third segment of the Safe Senior Hour. Joe Gavalis. I'm Joe Gavalis, and I'm here with our guest, Will Smith, who's a practicing attorney here in Atlanta who specializes in long-term care, negligent type cases. And we're just talking about some of the red flags people should look at when they have their loved ones or a friend that they go to visit, and should raise some issues. And the one of the last comments we were just talking about was the residents in the same clothing. And I think you made a good point about the
hospital gowns.
hospital gowns. I never
Yeah.
thought of that. That's
Yeah,
a
if you
great
go to
point.
a nursing home and you see a hall full of people in hospital gowns, run.
I think that operate on your gut feeling.
Absolutely.
You'll know when something doesn't look right.
Yeah.
Now, it might not look right, and when it doesn't look right, doesn't mean it's wrong, but it just, these are things, and you start adding these things up, you got to start looking at it and
Yeah.
trying to say, is this the best place for my loved one? I'll just tell you an interesting story. I was up in North Georgia and walked into a restaurant and with some of the people who work elder abuse matters. And as we were checking out, the owner of the restaurant says, what do you all know about XYZ nursing home? And, you kind of say, well, it's a nursing home. Said, I told my wife, I took my aunt there, went in, and I told my wife, if you ever put me in there, shoot me. Now, this is just somebody off the cuff saying, and we said, well, what are you talking about? He said, I went there unannounced to go talk to somebody and kind of walked around, and I wouldn't put my aunt there. I was looking there.
Yeah.
And so the idea is when it's not staged, you got to see how people are living and what they're doing. And it's a sad situation, but it goes on. As we know, nothing's perfect, but we should try to make it as perfect as possible. Well, as we talk about some of these abuses or incidents, can you go through some of the cases that you've worked on where some of the red flags were there that you were able to take it and help the family to try to get resolution?
Sure. And a lot of times family members, and you and I have talked about this, feel extremely guilty for failing to see, what was in front of them, but it's not their fault. Ultimately, it's these corporations that make money from the federal government without providing the care that they're supposed to, or screening, the staff, and you end up with abusive staff. But a lot of the cases that we deal with, actually, there's only a handful. It's typically bed sores. It's typically falls, dehydration, or malnutrition. It can also be bowel obstructions, which are a huge deal. And these are issues that we see on a regular basis. And the problem that most families encounter is that they're not going there on a regular basis, and they're not checking on their loved one. And so, we had a case last year, and I was talking to the son-in-law, and he, they visited his mother-in-law very frequently. Everybody was very close to her, but they really didn't check her out. They didn't ask about her care enough. And one day they get a call and said, hey, your mother has been sent to the hospital because of a bed sore. And he told me, he was like, in my mind, a bed sore is a tiny little red spot that's on your backside. And I thought, why would they send her to the hospital? And I'll never forget, this man broke down in tears telling me when he finally saw the bed sore and what it was, which anybody that doesn't understand this, the skin is an organ and it can fail and break apart. And when you are non-ambulatory, you don't walk and you're in one place for too long, the pressure from gravity in your bones can stop the flow of oxygen to the skin. And you'll develop these sores, which while they start out as a red spot, can end up a hole large enough to put your fist in.
Wow.
And that's what this woman had. And when he saw that, he was utterly shocked because they just had no idea. And she became septic and died because of that. But bed sores are a huge problem. Bowel obstructions, not something that you really think about a lot, but when you go up there, ask the staff, how many bowel movements has mother or father or whomever have they had, because that can lead to death. Also, dehydration and malnutrition. Like we talked about earlier, go up there and eat a meal. Well, Is your loved one eating a lot? Are they losing weight? Are they drinking water? Look at their skin, talk to their nurses. So what it comes down to, Joe, is not only do you have to do that reconnaissance beforehand, but once you put them in that facility, you've got to do your part and keep checking on them and keep being part of the healthcare team.
Well, those cases are just unreal. I know when
Yeah.
David was talking to us earlier when he used to be an EMT a long time ago, and he said he saw that same kind of situation with the bed sores and things.
Yeah.
And they're horrible.
And I can only imagine, because David was an EMT before Reagan's nursing home reform law. It's bad now, but back then it really was just a nightmare scenario that people don't understand about. I mean, it's they were a combination of psychiatric mental institutions and hospitals back then.
Right. And I just traveled through North Georgia on various discussions with seniors and with law enforcement. And even though it isn't a long-term care issue, it's people who don't want to leave their homes.
Yeah.
And they stay there. And
Yeah.
there's two cases that just stick out in my mind. Two happen to be elderly women, widowed, had some dementia, and insisted to their loved ones, to the neighbors, I don't want to leave here. Well, I don't want to leave here, meaning their home, is one thing. But on both cases, the one case, finally the neighbor said, I haven't seen Sarah and I haven't been in there. And Sarah pretty much was laying in there in her human waste, in her bed, nobody changing anything, nobody helping her. Her son would deliver meals to her once a week, but nobody would report it.
Yeah.
She ended up having to go with those horrible bed sores, taken, the sheriff's office had to kind of break in, I guess, taken to the hospital, and she passed in 2 days. And somebody has to tell somebody. That's why when we start off, remember, elder abuse doesn't report itself. Somebody who saw this or should have seen this should have reported to get the professional help in, because it was so bad. The bed sores interact with the sheets. And it was like they actually basically had to cut it out. And I don't mean to get gruesome about it, but the condition, when it gets that far, something's wrong. Somebody needs to tell somebody.
Oh yeah. In my perspective, and I'm with you on this, Joe. If you see something, say something. If you're not sure, if you're a mandated reporter, just assume you are.
Right. And
Just assume you are.
It was interesting you're talking about. We had one matter where a woman was in an assisted living. Her father, the woman, her daughter came to us and said there was an issue on the back of his hand. And they kept telling him it was just a sore. Well, it did exactly what you just said. It spread and stuff. They took him out, never took him to a doctor. They just treated it. A nurse treated it. Never went to higher professional standards. With somebody higher standards, I went, and it turned out that it just spread. And it turned out, based on that, his hand deteriorated. It infected his whole body.
Oh man!
And it ended up passing, and a big case being worked on that right now. But it started out something small, just exactly what you said, because she sent me the picture of it, which I sent to law enforcement and to the healthcare facilities, and it's like, this is bad.
Yeah, I just met with a family yesterday in North Georgia whose mother fell and scraped her knee, and they didn't put a proper bandage on it. And it developed into an infection that resulted in the condition of necrotizing fasciitis, which is flesh-eating bacteria, and within a week it killed her. So you're right. It's little things can be a big deal.
And make your voice known.
Yeah.
As we were just talking about Melanie, the ombudsman here.
Yeah.
Talk to the ombudsman.
Absolutely.
Talk to somebody who you trust. I just saw my aunt, or I just saw my mom, and this is what she looked at. Get some professional guidance. Nobody at all minds being talked to or a situation brought up in the law enforcement community, regulatory community, or I'm sure in the legal community, that there are issues. If there's no issues, they'll tell you.
Yeah.
But if you don't tell somebody, they won't know about it, and
Yeah.
it's just a shame. The issues like that go on, and nobody thinks to tell somebody.
Yeah.
And I appreciate your comments. But if it starts small, it's going to get bigger. And I hope this case that you get to the bottom of it.
Yeah, me too.
Now, there are some issues. We talked about CNAs and we talked about workers, not only in institutions, but also, you might want to hire some people to take care of your loved one who happens to live at home or whatever it is. There are registries out there. Are you familiar with these at all? I'll just let you. I know Tennessee. You talked about Tennessee. They have a registry that you can go on. The public can go on and will review all, and like CNAs, anybody, caretakers, and go back whether they have been involved in either a criminal or civil action concerning some kind of abuse against the elderly. So you make the decision whether you want to hire them or not. It's a great deal. The state of Tennessee is the gold standard right now for the registries. We're trying to do one in Georgia, but I think a lot of states are trying to go to them. I don't know if you've ever looked at it.
Well, yeah, I know that Georgia is trying to beef up its regulations on background checks. As far as a registry, I mean, you can go online and see the certification of nurses. I'm pretty sure you can do CNAs because I had to constantly keep my in-services updated. But it's not as in depth as Tennessee and as it needs to be.
Right. I think that in fact, we were told we believe that most states mandated CNA registries.
Yeah.
And not only the registry is that you have to get licensed and trained. Actually, there's you were a CNA. And I can ask you that probably the training should be more than what they have.
It should be. I went through a 2-week course that was in no way, shape, or form adequate. I mean, I was basically thrown on the floor. The first place that I worked, and I'm not going to mention the name, even though I'm positive they've been put out of business, really should have been raided by the FBI. The first place that I worked, we were thrown right into the water, right into the fire with very inadequate training. But now Georgia mandates about 75 hours of training for CNAs.
Which is great. And there is a registry with them. So with that, we'll end our third segment and we'll be right back.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
Whether cruising the strip in a 57 Chevy or taking the family on a vacation in a 71 Oldsmobile Vista Cruiser, you need to tune in to Classic Cars with Steve Ronaldo and Jim Weber every Saturday from 8 to 9 a.m. on americaswebradio.com.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Well, welcome back to the last hour, last segment of the Safe Senior Hour. Joe Gavalis here with our guest Will Smith, and we're talking about long-term care, things that as individuals should look for to see if there are any issues, red flags that you should be aware of,
Yeah.
and who you should bring question or what professionals you should go to, or if it bothers you, remember elder abuse, which we, as you know, we classify abuse as being physical, financial, and institutional. On the institutional side, please report. It doesn't report itself, and you need to do that. I was asking Will, we've seen a lot of cases made recently by concerned loved ones of their relatives or whoever it be in these long-term facilities are actually taking upon themselves to record a video recording of things going on. Can you just go into that, what touch base from your point of view? And I know laws in every state and every country are different, but it certainly goes to help make a case.
Yeah, it does, and I think this came to the forefront of everybody's mind in Georgia. There was a case where it was a World War II veteran who was screaming for help in bed, and you see the nurses laughing at him as he's dying, and it was a terrible case that was ultimately resolved. But, I saw the deposition of that, and the nurse, at first lies and says that she met the standard of care, that she did X, Y, and Z. And the attorney handling that case, who's a great guy and a colleague of ours, said, well, what about this video? And shows her the video, and you can tell that, she didn't realize there was a video. Videos, a picture or a moving picture is worth 1,000 words, and it is undeniable. It's certain. Some nursing homes like Illinois have a more lenient and resident-friendly law regarding videotaping in nursing homes. Georgia, you have to be very careful, because if you have a semi-private room and you place a video camera in there, that other individual that's in the room with you has a reasonable expectation of privacy. And so you're infringing upon their privacy and their healthcare privacy. If you've got your own room and it's private, it's like your house. That's why we call them residents, because they live there. So if you have your own room, do whatever you want to. Within the law, but still, you have to be careful about everybody around you, especially your roommate. But there's nothing better than catching somebody red-handed on tape and showing it to the nursing home.
Absolutely. And the federal law, it's a one-party consent, but other states have made it more restrictive, where it's a two-party consent, meaning if somebody walks into the room, technically you need their approval. I'm not sure. As I said, I'm not a lawyer. We have a lawyer here, but the laws are different. And
in every state.
But it is an incredible tool to use, and I know we see this in from the criminal side. A topic we haven't talked about yet in nursing homes that's getting to be very prevalent too are employees that are videotaping and using their cell phones, which are now our cameras. And putting it on the internet. Are you familiar with that? And
we just filed suit in a case. We are not completely certain what the video shows, and that's the reason that we filed suit in the case, because the family was made aware by the nursing home that apparently there was some type of either Snapchat or Instagram video made of their loved one, and they wouldn't get into the details. And without the subpoena power of the court, they're not going to give me the video. So, we're hoping that it's not anything troubling. But as you've said, there's been some very disturbing videos to come out of this area.
Well, I do know here in Georgia that we've had two cases.
Yeah.
It might have been one of the similar ones where they were taken, and there are laws that protect it, especially when they're put on the internet. I know I believe in Tennessee or Arkansas, there was a case where the CNAs and some other workers videotaped a senior who had almost total dementia, dressed them up in costumes and had them doing sexual things, and then posted it and were laughing at it. Now, they were criminally charged, as they should be.
As they should be.
Absolutely.
Yeah.
When people do that. Yeah.
And I hope they're serving time, too, for that.
I think they are, and
Yeah.
I think they're one of the other cases, they were arrested.
Good.
And they were using it and putting on Snapchat.
Yeah.
And I have no idea why people do that. It's just crazy. Now, the other point is we haven't really touched on is I know that's going on, and everybody should be concerned, is that when your loved one, whether it be male or female, who's in a long-term care situation, indicates, complains, hints at some improper sexual activity.
Yeah.
I don't know if you've seen any of that in your cases.
I actually saw more of it as a CNA. Yeah. So it's a huge problem right now. And it was a big issue last year with Consumer Voice, and CNN ran a whole expose on it. And so we're talking about sexual exploitation, sexual abuse that's coming from not only staff members, but potentially other residents and even sometimes visitors. And one of the problems is, aside from the staff issue, which I think Georgia is starting to address with more in-depth background checks, the other residents, you can have individuals who are sexual offenders, and they're not required to tell you that those other residents are sex offenders. And in Georgia, one of the methods by which, or one of the ways by which you can get off the sexual offender registry is by being in a skilled nursing facility. So you can be taken off. Yeah, and it's troubling. And so as far as that's concerned, the issue there is that is a very sensitive topic that people don't want to talk about. So if you've got a loved one in a long-term care setting, pay attention to their mood. Are they more hesitant to be in physical contact with you? If you're dressing them, do you notice any bruises around the perineal area, around their backside? Do you or any of the sexual areas? Do you notice them to be more withdrawn? Talk to them, but it's a huge issue. Like I said, it's not only staff members, which is absolutely incomprehensible. There was a woman recently who was in some sort of state of coma, not in this state, that ended up being pregnant. Clearly that is a rape.
Arizona.
Yeah, clearly that is a rape. But at the same time, there's also an issue. There was a representative in, I can't remember. It was a Midwestern state. He was actually a state representative, and he was charged with the rape of his wife, despite the fact that he said it was consensual. And eventually a jury found that it was consensual, because at the end of the day, and this is what a lot of people have problems with, just because you're elderly doesn't mean that you stop being human.
Right.
So they still have basic rights to be human, to have affection. But when it's non-consensual, or when they can't consent, that's a huge issue.
I know, and I can talk about a case that was brought by, remember we talk about mandated
Yeah.
reporters. Another person in one of the facilities reported they were concerned about the activities of a staff person, that every day he would go into this woman's room who was almost total dementia, and they'd hear him lock the door and go in, and would basically take sexual advantage of this woman who didn't remember or didn't know what was going on.
Yeah.
And how they actually, thanks on the tip, but they were able to tie in the videos that the that the company had in a nursing home for
Yeah.
the safety of everybody, showing the person going in and out,
Yeah.
compared with then they did medical tests with her and showed that there was sexual activity, even though she didn't remember it. And based on some other evidence, without going into the case, they were able to charge that person, and now he's pending trial.
Good.
But it goes on, and again, you as a loved one, as somebody they love or respect, if you think something's wrong, talk to a professional, talk to the ombudsman, right? I think Melanie said every facility will have some notice or somewhere, and I think every state has some ombudsman. We had Mark Miller on from Washington, D.C. one week. He used to be the ombudsman in New York and in Virginia.
Yeah.
And he's in D.C. now, and he was saying the same thing. Talk to your ombudsman or somebody that you love, your preacher, pastor.
Yeah.
Call law enforcement, because if you don't tell, that's the only way they're going to help, because these people have a hard time helping themselves. They don't know who to say or who to talk to.
Yeah. It doesn't report itself, like you keep saying.
Right.
Yeah.
It's a hard situation.
Yeah.
Is going through the internet. You can see cases. Just look up for situations dealing with nursing home abuse or long-term abuse. With that, we're going to end this segment. I want to thank Will Smith for being here.
Thank you.
It was very enlightening, and I want you all to remember that this was the Safe Senior Hour. Elder abuse doesn't report itself, and if you have any comments, questions, send us on our email, safe@americaswebradio.com. And with that, we will see you in the next session.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Get your pen and paper ready. If there's a move